Today we're going to be talking about the statistical evidence of the effectiveness and impact of mHealth in the healthcare field. Uh, the effectiveness of and impact of mHealth is very significant. It provides greater patient care, improved public health, improved efficiency towards the healthcare facility, and lower healthcare cost overall. But there's still some challenges that face mHealth today. There's a deficit of studies to pull from, so the information about all of the various mHealth aspects and applications are scarce. There's a lack of interconnectivity because there's varying different softwares used, so one healthcare facility will have trouble communicating with another. And on top of that, these infrastructures to build these and use these systems are very expensive. Now, the statistical evidence regarding how effective mHealth is in the healthcare facility is there's multiple studies that I chose from. Starting off with the efficacy of mobile apps to support the care of patients with diabetes mellitus. Now, they took from a rather large study, and from these studies they evaluated 1,263 patients, and out of them there was a significant reduction to their glucose levels, and for that one. And then there's the Mount Sinai Apple research study on how asthma shows feasible smartphone-only studies. Now, for this study, they just carried out studies solely off of phones and see if the data will be usable. Well, the total sample size actually was 7,593, and then during the 6-month process, it dwindled down to 2,317 people being robust users, meaning that they were constant users of the system. And this actually showed that these are reliable for patient-reported data. There's also the implementation of EHRs, which is used in mobile health, and the process of that used to be long, where they would actually write out on a form, on a paper form, and then transfer the information over to digitally. Now with this study, they actually directly implemented the data digitally, and with it, it actually made it 25% cheaper for the cost, and it was faster. There was also a reduction in errors caused while gathering data. More on the statistical evidence. Another study was on telemedicine compared with standard care for type 2 diabetes patients. And in this study, they took a randomized central outpatient facility, and they chose 40 members from there, 40 patients. And then from the 40 patients, they split them up from telemedicine care only and standard traditional care. And from that, you can see that from the information given that there's actually little to no difference in the treatment given from the two different treatments. So that actually means that it's a reliable resource to use, and would also help reduce patient waiting rooms, the number of patients in waiting rooms, so on and so forth. There was also the text messaging app for improved disease surveillance in rural Sudan study. And in this study, the South Sudan was actually having a lot of trouble receiving and sending information regarding disease, potential disease outbreaks, and because of this, there was an increase in disease outbreaks. So the solution was to implement SMS texting to the people and to the CDH staff who would receive the information, process it, and then implement that data. That data made it so that it was easier and faster to receive the disease surveillance of rural South Sudan. In conclusion, there are many benefits of mobile health, and they actually outweigh the disadvantages that are the current disadvantages now. The use of mHealth also improves the efficiency of healthcare facilities. Um, there's been multiple from those studies, and as you'll see from reading my paper, that that the efficiency of healthcare facilities improved quite significantly. Now, there's the one thing that's pretty simple and makes sense is that the basic infrastructures are cheap, whereas you'll use the SMS texting off of an Android software, which is very cheap, completely easy to do. But then when you go over to telemedicine, where you have to have a whole system in place for high-speed internet, you got to have great connectivity and whole nine just to have a face-to-face real-time, well, not face-to-face, but a real-time teleconference call with your patient. And this was my project. And here are my references.